repeating what's already been done. It's about identifying unanswered questions that matters to your patients and addressing them methodologically. So in this presentation, I will try to guide you through a step-by-step practical framework to take your clinical observation and turn them into a well-designed published study. Next slide, please. So there are what's called 7 secrets to build a great research question. We will start with the why, because every great question begins with purpose. Then we will move on to the PICO structure, study design, outcomes, and even sample size, math, and ethics. And finally, we will wrap with something every researcher loves. I'm talking about guidelines. So now I will elaborate each point in details. Next slide, please. So the first point is about the why. As you know, every great study begins with a simple question: why do we need this research? For example, as you know, in Africa, traumatic brain injury is a leading cause of mortality in adults. Yet there are a few local studies examining how pre-hospital delays affects outcomes. That's a problem worth investigating. Next slide. So when thinking about the subject matters of your study, you could have some question like, is this a common or serious clinical issues? Whether there is or not a publication, whether the results are contradictory or outdated, and why your findings change clinical practice or improve outcomes. Next slide, please. And I advise you to use the final criteria to assess the quality of your research idea. It's the same criteria that are using for evaluating some grants and funding also. And so your question should be feasible, interesting, novel, ethical, and relevant. Next slide. Regarding the second point, about the formulation of your question needs to be like the PICO framework. P for patients or problems, I for intervention or exposure, C for comparator, and O for outcome. An example of this PICO framework, you could say, in adult patients with severe TBI, which is the population, does early decompressive craniectomy, which is the I, the intervention, compared to conservative management, which is the comparator, improve an outcome at 6 months for the O. And you can also use in some kind of study PICO for E instead of I for exposure-focused question, or PICOTS by adding time and study type. We will see this in next slide. Next slide, please. So the third point is to choose the right study design. For example, if you want to describe a rare phenomena, the best study design would be case series. An example could be aware craniectomy, for example. If you want to measure prevalence or association, the best design will be a cross-sectional studies. If you want to have a follow-up over time or prognosis criteria, the best study design is here the cohort. Do you hear me?
Yes, we can hear you.
Okay. Okay. And just remember that if FCTs, even if it's the top of the EBM kind of study design, if they aren't feasible, well-designed observational studies with robust statistical methods are still valuable. Next, please. Okay, so now let's define your primary outcome and variables. So your primary outcome is the heart of your study, and you need to choose one main outcome for your research question. And you could have many secondary ones, but the main primary outcome will define the kind of study and also the sample size of your study. So it should be clinical meaningful, objectively measurable, and clearly defined in advance. You will also need to define some exposure like co-founder, and please don't forget to create a clear data collection plan earlier. This will reduce missing data and aligns your clinical work with your research. Next, please. So this question very repetitive and it's fundamental. It's about the sample size of your study. So a good study needs to have enough power to detect a real difference. And to have this sample size, you need, it depends on 3 parameters. The first one is the effect size you expect. For example, you expect a reduction from 10% to 5% after an intervention. The variability of outcome, it's coming from the literature. The alpha, usually it's about 0.05, and the power of the study, it's from 0.8 to 0.9. And with all these parameters, and with the help of the biostatistician, you will define your sample size. And remember, if the retrospective studies, while easier to start, we still use a plan and clear variables. Next slide, please. Now we will talk about some ethical consideration. And as you all know, every study on humans must respect ethics. And you need to have a checklist, begin by the IRB, the Institutional Review Board, or Ethics Committee approval. Then you should also have informed consent. And you should verify the confidentiality to make the data de-identify and secure files. And if you want to make your LCT, you should register it on clinicaltrial.gov, for example, as a platform. Next, please. And even the best designed study can fail to make an impact if it's poorly reported. So I highly recommend the Equator Network, which could help researchers improve transparency and completeness in their publication. So you could use the checklist that match with the design of your study. There is a specific checklist for each design. For example, if you want to do an observational studies, you should use STROB. If you want to do a systematic review, you should use Prisma checklist, etc. Yes. Next. And make this Equator Network as your friend. Most journals now require this checklist. They also help you structure your paper from the start. And there are 3. There are some sample, and they're accepted by major journals. Yeah. Next slide. So to build a solid research question, it's not just about having a good idea. It's about structuring it properly. So we have just seen 7 secrets that you need to go through. Think of them as checkpoints on your journey, from the curiosity that you have based on your clinics to the clarity that are required in publication. Yeah. Next, please. And last but not least, a well-run study is a team effort. So in my experience, collaboration boosts your impact. And even small centers can join forces to produce high quality data. So with a sound design and attention to quality, your role can drive change not only locally, but also globally. Yeah. Next, please. So thank you for your attention. And I look forward to your question, your idea, and I wish you a successful projects for this series of webinar. There is still one, I think.
Yeah, thank you so much, Professor Mamouchi. Thank you for accepting our invitation and for giving this insightful presentation. You've underlined many things during your presentation, and I believe there will be many questions that will come over after your talk. They have been wonderful, and you have underlined our ability to develop effective research questions to improve various research methodologies and skills aligned with study design, and talk about the research objectives. You've said it all, and I invite all the colleagues that are with us to ask the question. You can write in the chat if you want. I have to tell you that Professor Mamouchi is having another meeting right after this presentation, so she will not be able to stay with us till the end. So in case you want to ask any question, I suggest we take your question right away before we get to the next presentation, the next speaker.
Yeah, I still have 10 minutes. And you have also my email and my personal contacts. You could chat with me by WhatsApp also and by emails if you have any idea and you need some methodological advice. I will be more than happy to reflect with you on your question.
Okay, thank you so much, Ma. Thank you so much. So I'm not seeing any question in the chat. Let me check again. Okay, so and in case you have your question come up later, you can also write in the WhatsApp group. We do have a WhatsApp group for the young CAANS, the young neurosurgeon, the young African neurosurgeon. So all your questions, all your question will be sent to Professor Mamouchi, or you can write to her directly to a mail that is on board. Yeah, Dr. Kabulo, please go ahead.
Thank you so much, Dr. Dokpunu. Thank you. Congratulations, Professor Mamouchi. That was a very great presentation, concise and precise. I really enjoyed your presentation. And my question was, in case you are submitting for your RCT and you realize that there is something which resembles to the one you are submitting, will you get the registration number, or they will advise you to change the topic?
As far as I know, I don't think that the platform of the clinical trial have some advisor or some reviewer before giving you the number. It just make your portal registered, but it's your role to see in advance if there is some same protocol. It's the same case for Prisma. When if you want to run a systematic literature review in some topics, there is a Prospero, which is another platform from Equator Network, which is allow you to see all the protocols that are already registered. And then we have two questions. If the protocol is not registered, so it's okay. But if it's already registered, you need to ask you two questions. If there is an update between the time of the registration of this systematic review and your own projects, you could run your own systematic review. If there is not novelty, so then I will advise you to maybe change your question and not run another systematic review on the same topic.
Thank you so much, Professor. Have you assisted in your experience of any rejection from that case? Like an RFP, you want to register prior, then you get a rejection?
No, in my experience, they don't reject it, but it depends on how you formulate your protocol and what you fulfill in each variable. But I don't see any rejection.
Thank you so much, Professor.
It's my pleasure.
Okay, thank you so much, Dr. Kabulo. Dr. Kabulo is the chair of the Young Neurosurgeons. He is a neurosurgeon working in Lubumbashi in the DRC. Thank you so much.
It's my pleasure. And I will be happy to participate in another webinar another time if you need to.
Of course, we need you. Thank you so much.
We always contact you, Professor.
Okay.
With these presentations, we will need you.
It's my pleasure.
Thank you so
Thank
much.
you very
Thank you.
Okay.
Welcome.
Thank you.
Okay, if there's no other question or no other suggestion or any comment, we will get on to the next best, which is supposed to be the first presentation.
Okay.
We suppose go first of all with the research question, defining the research question before getting to the method. But since Professor Mamouchi was having another meeting by 4:30 GMT +1, we do allow her to go ahead and present our topic first of all. Before we welcome our big brother that understands her very well and always with us. I will say the number one of the newcomers. Dr. Esene, thank you so much. If he's not someone that we need to present, I believe everyone here knows him very well. He's a big brother, so thank you so much for always being there when we need you. I will not say more than that. I will leave the floor to present your topic. Thank you so much.
Thank you so much. Good evening to everyone. It's always a pleasure for me to talk about the topic which I'm so passionate about. Before I proceed, I'd like to sincerely congratulate the Young CAANS for putting up this webinar, the chair, Dr. Kabulu, the chair of education, and the moderators, May, who is in the OR, she couldn't attend, and of course, who is a young neurosurgeon coming up very powerfully and also very passionate about research. It was so much pleasure for me to listen to Professor Mamouchi. I was wondering what I was going to say because she was actually talking about what I was going to say. You know, we always start about when we want to conduct research, you have to start with the question. So unfortunately, we started with the study design. Nonetheless, you know, good science is driven by rigorous research question. And the first step, the initial step to conducting research is by asking a very good question. It's like building a house. If you want to build a house, you need to have a very good foundation. The foundation is poor, then the house is not going to be very solid. So having designed and presented a very strong, rigorous research question is going to enable you to be able to put forth a strong protocol, which can be published as my previous speaker said about in Prospero or other databases, have a good study plan and actually then conduct the research. So the whole issue about research is about asking a very good research question. That's why the father of evidence-based medicine, Professor Saget, in the 1990s, when he came up with the paradigm shift of evidence-based medicine, he said the question being asked determines the appropriate research architecture, strategy, and tactics. Okay, and it's not just about somebody's opinion, authority, or expert, or school of thought. So the whole concept of research is centered around the research question. That's why I always try to underscore that an approximate answer to a right question is better than an exact answer to an approximate question. So the key concept is asking the correct question, asking the right question. Well, the question you have to look at, it depends on the kind of research you're looking at. You all know research in general is classified in two major categories. You have bench research, which is laboratory research, and you have clinical research, which is bedside research. When you go to clinical research, you have the quantitative and the qualitative. You know, about 85% of neurosurgical research is quantitative. So my talk today is going to focus on quantitative, the questions related to quantitative research. So when you come to quantitative research, you have the primary studies when you're conducting de novo research, and then you have secondary research. So the question you have to design depends on the kind of research you're looking at. Is it primary research or secondary research? So if you're talking about primary research, as I said, you have to conduct new research. So therefore, you're asking a question to develop a protocol, and you have to collect data from patients, the subjects. Okay, but if you are talking about secondary research, you're going to be getting data which is already existing, and then you're actually summarizing it. So be it primary research or secondary research, although they have this, the key, the core, or the common point is the research question. And therefore, in neurosurgery, there are so many kinds of research questions. For example, if you want to look at the relationship between traumatic head injury or brain injury and maybe the development of brain tumor like meningioma, then you are talking about a question of etiology. If I look at the relationship between exposure to radiation and development of a glioma, you're talking about a question of etiology. If you're looking at the diagnostic power of maybe MRI and a CT scan in maybe a brain infection, we're talking about the question of diagnosis. Most of the questions in neurosurgery are focused around therapy, that is treatment, because neurosurgery is an intervention-based specialty. For example, if you're looking at the role of the endoscope and the microscope in the brain tumor, then you are talking about the questions of therapy. Sometimes we want to see the evolution, natural history of the disease, and see what is going to happen if nothing is done compared to when something is done. We're talking about questions of prognosis. Of course, we're not functioning in a world of isolation. We need resources for us to be able to do research and practice neurosurgery. So therefore, we need to understand the economic dynamics centered around medicine and neurosurgery. So therefore, we talk about questions of economic analysis. For example, do we buy a new microscope for the hospital to operate brain tumors, or we increase the salaries of the doctors or the nurses who are working? These are questions connected to economic analysis. So as the previous speaker said, the initial step of research is developing a research question. When you develop a research question, you need to evaluate this question for appropriateness. So to develop a research question, many tools have been developed, which are in there. You can find them on the internet. You have the SPIDER framework, okay, which is concerned with people involved in mixed research methods, that is quantitative and qualitative. Okay, you have the SPICE and the ECLIPSE, which are involved for public health practitioners, okay, who want to evaluate projects at the level of the ministry, at the level of organizations, okay, services and policies. The most important I want you to remember are the PICO and the FINA framework. PICO, as she said before, stands for Patient Intervention Comparator and Outcome. Sometimes we add TS for time frame and the settings or study design. And then the PICO helps you to develop the research question, whereas the FINA framework helps you to evaluate the appropriateness of the question. But regardless of the framework which you use, the goal is to be able to delineate who, what, why, and how of the research project or the research you want to carry. You know about this guy, Richard Quest, in the CNN. He always say who did what, where, when, and why. This is a concept of research. When you are developing a research question, the question can be about who. You're looking at the effect on two groups of people. It can be about what? Maybe surgical approaches. It can be about where. We're looking at the effect of an intervention in two geographical areas. It can be when. You can be looking at the time series, maybe what happened before COVID, during COVID, and after COVID. And we're looking at why. Maybe we want to close the research gap. So having understood some of these basic concepts, we know the practice of neurosurgery today is based on the paradigm shift of evidence-based neurosurgery, which is the integration of the best research evidence, surgical expertise, experience and judgment, patient's values and preferences to provide optimal care to the patient. And there are a number of steps involved in practicing evidence-based medicine. We call this the clinical thinking. The process of clinical thinking starts by asking a question. Okay, you acquire data, you clinically appraise this data, and you apply and you take action. So how do you, we're not going to talk about the rest of the step, we're just going to focus on asking the right question. Again, as I said, this is the most important step. How do you ask a question? I said there are a lot of tools that have been developed to help you ask the right question. This is important because if you take a clinician, when we are practicing in the hospital, we are faced with a lot of challenges, problems. When we encounter a problem, for example, we have a case that comes to us with a posterior fossa tumor and hydrocephalus. We want to ask that do we do a VP shunt or endoscopic TET ventriculostomy? We need to convert this problem into a research question. Okay, we might want to conduct the nouveau research. In that case, we'll talk about the primary research, or we want to go to the literature and look at what has been done already, and then we look at the evidence that it has produced. We talk about the secondary research. We then convert this research question into objectives. Okay, and thus the research question is very important, not only in that it defines the objective, it helps in defining the inclusion criteria, it helps in defining the search strategy, it helps in choosing the study design as underscored by the previous speaker. So the core is with the research question. Once you define a good question, the rest becomes very easy. Keep it simple. Life is so complicated. You look at the picture here on the right, you look at the guy here, you ask, how can he be saved? This is a very difficult question. He has here the snake, he has here the lion, he has here the crocodile, and the stick is almost half cut. So if he has to move, then he is in danger. So this is a difficult question. This is difficult to answer the question of how to save this guy is difficult. So therefore, don't ask difficult and complex questions in research. Ask simple questions. And a good research question should be focused, well-structured, and answerable. Only ask answerable research questions.
Sorry, we can't see the slide. Are you showing a slide?
Yes.
I can see properly.
Can you see the slides? Hello?
See the slide. Me, I'm seeing the slides.
I can see, so maybe your bandwidth is
your side.
Okay.
I can see
Just check your side.
Okay.
It's okay.
Yeah,
it's okay.
You can
just check. Yeah, maybe your internet is a bit slow. So I was saying, the initial step is to ask an answerable question. And the characteristic of a good question is one which is focused, well-structured, and it should be answerable. And I said there are tools that have been developed. I mentioned the PICO, and I also talked about the final framework. So I'll start with the PICO. The PICO tool for beginners is what you use to develop the question. The final tool is what you use to evaluate if the question is appropriate. So the initial step is to use the PICO format, which is the most widely accepted format. Of course, there are so many formats which exist in research, in clinical epidemiology, but the most accepted is the PICO format. P stands for the patient, the problem, or the population. E stands for intervention. Since we are surgeons, we talk about intervention, but if you're talking about people in internal medicine and clinical epidemiology, we talk about the exposure. Okay. C stands for the comparison group or the comparator or the control group. O is the outcome. And then sometimes we talk about the PICOs. Instead of PICO, we talk about the PICOs, the at C and S. C for the time frame, S sometimes for settings where the study is being done or the study design. So let me give a clear example. As I said, P, you're asking the question, who are the group of patients I'm interested in? I, what intervention do I want to evaluate or assess? C, what is the comparator? And O, what is the outcome? C, the time frame, and S, the study design. Let us look at a very simple example, which we're all conversant with, looking at the role of endoscopic, and microscopic pituitary surgery for pituitary adenomas. A good research question, as I said, should be focused. So you cannot just say the role of endoscopic versus microscopic pituitary for pituitary adenomas. No, pituitary adenomas are further classified into have the microadenomas, the mesoadenomas, the macro. They have the functioning and the non-functioning. So you have to be very specific because to provide a good answer, your questions should be very refined. So let's say our problem is adult patients having functioning pituitary adenoma. We want to see if the endoscope provides better results than the microscope. In clinical research, when you're comparing two things, the standard procedure is always the old procedure, the one that has been used before, and then the newer procedure is always the intervention. So that's why you see the endoscope, which is relatively new compared to the microscope, is considered as the intervention. And then C, which is the comparison, is the microscopic, which is the standard of care which was the standard of care for pituitary surgery. And then now the outcome. you have to define the primary outcome, you have to define the secondary outcomes. If you are talking about functioning pituitary adenomas, we want to see the amount of tumor that has been removed. We want to see what happens to the hormones after tumor resection. The tumor is found around the cellular region with the optic apparatus. So we want to see what's going to happen to the vision after the surgery. So this is how we develop a research question. Let me give another example here. If somebody says, what is the role of discectomy in lumbar disc herniation? This is a very vague question. This is not correct. This is not how to pose a question in clinical research. You can put the question this way. There are so many other ways which you can rearrange this same question, but if you want to put it in the most appropriate way, you can put it this way. In adult patients presenting with degenerative lumbar disc herniation, so the patient is the P, okay, can also say maybe lumbar disc herniation can be the population of the problem. In a spine unit, you are defining the setting. What is the effectiveness of endoscopic discectomy? This is the intervention because the endoscope is relatively new compared to the microscope or open discectomy, okay? So the microscopic discectomy is going to be the comparison group. On the severity of sciatica. Sciatica is the outcome because the patient presenting with the lumbar disc herniation will have radicular pain, commonly sciatica. And when are you going to measure this outcome? At 3 months. You can say maybe at immediate post-op, you can say at 1 month or 3 months. So by so doing, you have defined your P, you have defined your I, you have defined your C, you have defined your O, you have defined your T, and your S. Another example, which I saw in the literature, somebody presented his research question as such. What is the role of dural resection in meningioma? Again, this is not appropriate. This is very vague question. It is very broad. It is not focused. Okay. You can put the question this way: in patients presenting with convexity meningioma. So now you are focused on a particular kind of meningioma because the approach to a convexity meningioma is different from the approach to skull-based meningioma. Okay. In the neuro-oncology unit, you're defining the setting. What is the effectiveness of dural resection? This is the intervention, okay, compared to dural coagulation as a comparison group on the tumor recurrence, which is the outcome at 10 years. So you can see that from this question. If somebody says on tumor recurrence at design, which so you then have to convert this research question now into an objective. So the objective should be a precise statement of the primary, okay? And if possible, the objective should follow this format to assess the effect of an intervention or a comparator for a health problem okay? You define the people, you define the disease, you define the setting. Let me give an example for you to understand. So you say, in people with a health problem, okay, that is the P. How effective, okay, you take an intervention and then take a comparator in reducing the outcome. You turn this question into an objective, okay, to assess the effect of the intervention of the comparator for the health problem, okay, and you choose the group of persons that you're going to focus on, the disease or the setting. So let's take a very simple example, which everybody can easily understand. In patients with supercellular meningioma, okay, with visual affection, so this is the problem or the patient, okay, we are comparing the eye is going to be the frontolateral approach, okay, and the comparator is a subfrontal approach. You know, for a very long time, the subfrontal approach was the standard of care for supercellular meningiomas in improving visual outcome because the supercellular meningioma will obviously compress the visual apparatus when it is very huge. You now convert this question into an objective. The objective is going to be what? To assess the effectiveness, that is the visual improvement, okay, when you compare the frontolateral approach, okay, to the subfrontal approach in patients with supercellular meningiomas having visual affection. So that's why when papers even come in journals and we have to review them, the way you define your questions tells the reviewer or the editor what their paper is all about. When we notice that the research question is not well posed, we will realize that the objective is not well defined, is not related to the research question. We therefore understand that maybe the author of the paper don't have a good grasp of research methodology and paper writing. So once you've done this, you've converted your problem into a question. You converted the question into objectives. Then you have to select, for example, if you want to go to the literature to search information to back up your decision in making providing care to the patient, you also have to follow the PCOT format. You must not follow, you must not go from P, I, C, O. Sometimes it can start from S, sometimes it can start from I, O. So it depends on where you arrange it, okay? We know that randomized surgical trials are the gold standard to provide care to patients. So therefore, if we are looking for the best evidence, for example, to provide optimal care to our patients, then we will select papers which are based on randomized clinical trials. We might look at the papers where they focus on small microadenomas, mesoadenomas, or macroadenomas, okay, or maybe big giant adenomas like Hardy type 5. You look at the intervention where the papers focus on the frontolateral approach, comparing it to the subfrontal approach or to other surgical approaches. You have to define all these. So when you use the PICOT format, it doesn't only help you to define the research question, it helps you to define the objectives. It also helps you to define the selection criteria. So having defined the PICOT helps us to develop the research question. Well, we all know that a well-elaborated research question may not necessarily be a good research question. I told you before, the question about the meningioma, if we are comparing, say, the resection compared to dural coagulation, and we want to see recurrence at 1 month, it is a well-written research question, but this question is not a good question because we don't expect to have recurrence at 1 month. We expect to see recurrence after so many years. So we use now the final criteria to evaluate if the question is appropriate. Okay, we look at the proposed study. Is it possible for us to achieve our goals using that research question? Is it ethically correct? Okay, is it bringing in something new? Okay, is it relevant to our specialty? So it is using the final criteria that you actually evaluate the research question which we develop using the PICOT. That's going to help you to do a good research. So FINA stands for feasibility. When you define a research question using the PICO or the PICOT, you have to evaluate it with the FINA to see if the question you've actually defined is feasible. Okay, I'm going to give you some few examples shortly. Is the question impactful? Is it interesting? Something which we have to work on? Is it bringing something new? Okay, is it ethical? Okay, we're not going to randomize a training which a treatment which is already known to produce very good results. For example, you know, when the effect of penicillin on infections, it was never proven through a randomized clinical trial. It was just a simple case series. All the patients that were given antibiotics got well. So there was no need to move on to do a randomized clinical trial. So sometimes it's unethical to answer a question that has already been answered with lower study designs. And you have to see if it is relevant. Is the study relevant to you? Is it relevant to the funders? Is it relevant to clinical practice? So this is a table which I took from internet. The final criteria, what does it mean? This is where it is. This is the core of the research question. Once you define a research question using the PICO or the PICOT, you have to subject it to the final criteria or the final framework to evaluate for effectiveness. For example, you ask, is it possible for us to carry out the research? For example, I might have a very brilliant idea. I want to do a randomized clinical trial, but I'll ask myself, do I have the funding to do a randomized clinical trial in my hospital? Of course not. I don't have funding. So, and the government is going to provide me with the money. So therefore, it is not feasible. Okay. So sometimes when we realize that the study is not feasible, we can just do a pilot study to have an idea of what it looks like and then collaborate with others who have the resources for us to be able to bring data together to answer the research question. Sometimes it might be very costly. So if I discover that conducting a randomized clinical trial is very expensive, I can resort to using a cohort study, a case control study, okay, to answer my question. Sometimes you also have to modify the inclusion criteria. If I calculate my sample size is too large, it's about 1,000, I might decide to change the sample size because maybe this is too costly. So therefore, I might not be able to have the resources to realize, to conduct the study. After looking at the first letter of the final criteria, which is F, standing for feasibility, you have to look, is the study interesting? Does your project align with the funding agency? If you have a grant, a fund to conduct research, the funders have to agree on the research question. They have to agree on the study designs which we have to use because they are the ones providing the money. So if your study doesn't align with the funders, it doesn't align even with their personal principles, because, for example, I might be interested in pediatric neurosurgery, I might be interested in skull-based, I might be interested in vascular neurosurgery. But if you bring a topic in something which I might not be eager to work on. So it has to be interesting, it has to be impactful for it to be realized. Novelty. Is it something new? When we conduct research, when we convert our research question to objectives, we want to bring out, maybe we want to confirm existing knowledge. We want to bring out a gap. So if you are conducting research which is not going to confirm something which is already existing, or want to bring out, to fill a gap that is existing in the literature, then we're just wasting time. If we just want to publish maybe because we want to change grade in the university, then we're actually wasting time and resources. So therefore, we have to consider the novelty. What knowledge the research is going to bring on the table. Ethics, you have to consider the ethical principles, which were also underscored by the previous speaker. You have to be conducted in accordance with the Helsinki Declaration. Do you have the IRB certification? Is the ethical approval, and so on and so forth? Is the study you want to do, is intervention going to produce harm? Okay, and so on and so forth. So we have to look at all these parameters, because if it has to do so, then it won't be accepted. And then, of course, the relevance. Is this study relevant for your practice? Okay, is it relevant for your to your colleagues in your local settings? Is it relevant to the Ministry of Health that are going to design the policies? Is it relevant to the global neurosurgical communities? So it's by evaluating the research questions using the final criteria that you are able to say, yes, I have developed a good research question. So, as I said before, a good research question helps us to select to define a good selection criteria. When we are talking about primary research, we'll be selecting the subjects. When we talk about secondary research, we'll talk about the studies that are going to be included. So again, when you are designing your selection criteria, you have to also consider the PICO. You have to select based on the participants for the P. You have to select based on intervention, I. You have to select based on the outcome. You have to select based on the study design. You might want to do a study, for example, it's a meta-analysis based just on observational study. Okay, you want to do a meta-analysis based on randomized clinical trials. So these have to be defined using the PICOT format. Again, don't forget about the statistics. The previous speaker made mention about that. You have to see the statistician before you start your research. Once you've developed the research question, you've developed one, you've evaluated it using the final framework, you have to think about the statistics. If the study I want to do is an ecological study, I should be able to bring out the frequencies. Okay, so my question would I be able at the end of my study be able to measure the prevalence or the incidence of a disease? Then therefore I have to make sure that the research question for the cohort study is well written. If I have to, the study is going to be a cross-sectional study, then I have to ask a question that has to ensure that I am able to measure the prevalence at the end of my study. If I'm doing a case control study, I should be able to measure the odds ratio. If I'm doing a cohort study and the surgical trials, I should be able to measure the relative risk. So you have to think about all these when defining the research question. Think about the problem, convert the problem to the question to the objectives. Think about the inclusion area, think about the study design, think about the statistics. Once you've had all this together, you are now define a good question, which is going to produce results that can be applied to your patient, change practice, change the guidelines that are used in your setting, change the policies, and also change the development of guidelines globally. So to summarize, good research starts by defining a rigorous question, okay? And a good research question does not only define the direction in which the research has to take, it helps us to define the objectives, the study design, and the selection criteria. And my recommendation to the young neurosurgeons, those are beginning research, always use the PICO and the FINA framework. There are so many frameworks we find on the internet. With my experience over the past decade, the PICO and the FINA are the simplest for you to start with. Again, research is very important in neurosurgery. There was the Boston Declaration a few weeks ago, and neurosurgeons are now taking research very important. Before, surgeons used to believe that operating patients was the most important thing. Yes, it's true, we are surgeons. We want to operate our patients. We need to operate our patients based on evidence, the principles of evidence-based neurosurgery. And for this to happen, we need to associate surgical practice with research evidence. So that's why in a few weeks to come, you're going to see the recommendations from the Boston Declaration. And I keep on encouraging you, keep on publishing. If you want the story of Africa to be heard, you need to write. You need to write and publish. Otherwise, other people are going to write in your place. Thank you so much.
Thank you so much, Dr. Esene. Always very clear, concise, precise. And I believe all the colleagues that have been following this great presentation from the beginning till now must have been able to get the summary of what have been said. This is, you are giving very important issue for free. I must say, because we pay for those information you are showing. We paid to be we paid for those information you guys are getting for free. So please. Thank you very much, Dr. Esene. And if you have anyone have any question, please you go ahead and ask your question. What I can say is that from this talk, some important points have been highlighted. The importance of well-formulated research questions, the technique for developing clear and focused questions, aligning questions with research objectives in neurosurgery. Many examples have been given about our field. This is very important. This is, you know, the topic have been developed with practical issues. You know, we have been served gratefully. Thank you so much. And the slide before the last one is showing us the research questions, the methods, and the statistics. That one I don't know if all the colleagues that have been with us have seen it. You need to put it somewhere beside your bed. That slide that is showing the research. You have the research question. Your question that you asked will count on a specific method, and that method to answer the question will need a statistical analysis. This is very important, and those that know what you're talking about, when they read your paper, they will get to know that, okay, this is well done, or this is no. So thank you so much. All these things will contribute to, as the speakers have said at the end, it will contribute to help us to have an insightful and significant paper from Africa, written by Africans and published by us. Thank you so much. I will check if there's any question in the chat.
Yeah, there are 3 questions in the chat.
Okay,
Doctor.
please go ahead.
I think it's from Fred Ojomodo. He said, kindly elaborate on the different types of observational studies. That's the first question. The second one is, what is the relationship between PICOT framework and the title of a research? And then he asked, which is better to use between PICOT and FINA as a framework in research question? That's from Abdullah Kim. I think you can start from there.
Thank you, Hugh, for your comments. What are observational studies? At the beginning, I tried to give an overview of the study designs in medicine. So as I said, in the simplest term, okay, research can be classified as, you have bedside research, okay, which is laboratory research, and then you have clinical research, which is bedside research. When you go to clinical research, you have the quantitative and then the qualitative research designs. Unfortunately, in neurosurgery, there are very few qualitative studies that have been conducted. I mean, the first paper we actually published a few years ago about the qualitative methodology. When you go to the quantitative now, for you to understand, we have the primary study designs and they have the secondary study designs. In the simplest way, the secondary study designs are called the reviews. Okay, it can be the traditional reviews, the scoping reviews, okay, the systematic reviews, the meta-analysis to the overviews. When you go to the primary study designs now, they are divided into 2 arms. Okay, you have the descriptive studies and you have the analytic studies. So observational studies, the word observation is used with compared to interventional studies, because when you are conducting research, for example, you have 2 groups. Somebody had to allocate the intervention, okay? So if the investigator is the one allocating the intervention, then you are talking about interventional studies or experimental studies. But if you are just observing patients in their natural environment, okay, to see the outcome, you are not the one who allocated the intervention. For example, the medical students come to the unit and sees cases that were operated with the endoscope and the microscope, okay? He evaluates to see the outcome. This is observational because the medical student did not allocate the intervention. But if the surgeon decides to randomize, for example, a group A to microscope and group B to the microscope, then that is experimental. So the different kinds of observational studies, they are divided into 2 groups. You have the descriptive ones and they have the analytic ones. Analytic means a study having a comparison group. Descriptive means not having a comparison group. The descriptive studies, which are observational, include the case reports, the case series, okay? You have the descriptive cohort study. The descriptive cohort study is a study which a methodology which our team actually introduced into neurosurgery because people were confusing the descriptive cohort study for case series. So the descriptive cohort study is actually different from the case series. Then when you go to the observational studies, which are analytic, that is, they have a comparison group. The generic ones are 3. You have the cross-sectional study, you have the case control study, and they have the cohort study. Of course, you have so many other ones like the nested case control study and others which I don't want to go into. But for the beginners, the 3 most important analytic observational studies are the cross-sectional study, the cross case control study and the cohort study. When you go to the second question about the PICOT and the title, exactly. Actually, the PICOT format, as I said, stands for P, the patient, the problem, or the population, I, the intervention. Sometimes we use E for the exposure, C, the comparator, okay, or the outcome, and then C, the time frame and the study design or the settings. If possible, try to frame your research, the research title to be in line with your research question. If your research title has these elements, in your research title, we can see the problem, we can see the intervention group, we can see the comparison group, we can see the outcome, the time frame is going to be very excellent. This makes it easy for somebody to easily follow up your research, because when a reviewer, for example, the editor picks paper to review, he looks at the title, he looks at the abstract. If they're not very appealing, sometimes you get a desk rejection. So if you frame your study title in accordance to the PICOT format, it is an extra, it gives you extra points. It makes your research much more appealing for the readers and for the reviewers. And then with respect to the PICOT and the final framework, I told you the PICOT helps you to develop the research question, okay? Then the final framework helps you to evaluate if the question is appropriate, if it is pragmatic, if you can actually, is it feasible, okay? Is it something which is interesting? Is it something which brings us some new information? Is it something which is going to help you in your clinical practice? So for you to start, it's good to start with the PICOT. The PICOT helps you to develop the question, okay? So PICOT for development of the question, and then the final framework is for you to evaluate the appropriateness of the question. I hope I answered your question.
Yes, thank you, Dr. Isene, for answering this question. I think we have a last question from a panelist. I think Dr. Toponi was emphasizing on the fact that please panelists can raise their hands up to ask directly questions to Dr. Isene as he's here with us. So the last question was, please show the slide about when to use OR or RR.
Okay. This should be the slide, right?
Yes, exactly. This question was from Dr. Annie Kingsley. I hope he's still with us. And
yes, thank you. Thank you. Thank you. I've seen it. That's it. Thank you.
Then there's, I think, a comment from Dr. Evely Kuya. I don't know if you can just go ahead to ask the question, or he wants us to, or Dr. Eve to ask the question for him, or to comment for him. It's in the chat. It says to Dr. Isene, we, especially I, that's him, Dr. Eve, struggle in applying no evidence-based routine practice in neurosurgery due to lack of high-ranked design or to ethical limitations to conduct RCT, or sometimes a good observational cohort studies. What is your opinion in regards to experts' consensus or top expert opinions?
Thank you, Dr. Nathalie, for this question. It's true, if you look at the evidence-based hierarchy, okay, you have expert opinion is found at the base of the track of the pyramid. But again, we are in a field of neurosurgery. And if you remember very well, I talked about the definition of evidence-based neurosurgery. Evidence-based neurosurgery doesn't exclude, it doesn't preclude expert opinion. It's true, sometimes people feel that expert opinion is contrary to evidence-based neurosurgery. This is not true. Evidence-based neurosurgery integrates the available research evidence, okay, surgical expertise, experience, and judgment. So this is where the expert opinion comes in, because expert opinion goes into the surgical experience, expertise, and judgment, okay, the patient's values and preferences to provide optimal care to the patient. So expert opinion is not useless. but expert opinion has to be integrated into the framework of evidence-based neurosurgery. If somebody refuses to use all the components and things that may be out, because I operated 5 cases and I had successful results, I have to apply this to all the other cases that I see, then this is wrong. Okay, you have to look at the bigger picture, you have to look at the big picture. It's not just about the expert opinion alone. You have to integrate the expert opinion into the bigger framework of evidence-based medicine, which brings together the research evidence, the surgical expertise, and the expert opinion, which I'm talking about, okay? And then also have to think about the patient. And lastly, also you have to think about your environment, your setting. You might be trained to do endoscopic surgery, but if in your setting you don't have the endoscope, you have the microscope, sometimes you have to resort to using the microscope in the place of the endoscope. This doesn't mean that you are not practicing evidence-based neurosurgery. No, this is not correct. So you have to understand where the paradigm shift we are coming from. It is integrating all these tools together. So expert opinion is important, but alone it is prescribed. We have to integrate it into the bigger picture of evidence-based neurosurgery to provide optimal care to the patient.
Okay, I can see there's no more question. Dr. Ntari, is there any other question? Can't see any other question in the chat.
Any other question in the chat group?
Okay, thank you so much.
Welcome.
Is there no other question? Maybe we can end up this session. Before we finish the session, I would like to remind all the participants that this course is very important. This course is very important, and as Dr. Essene said, a good research question is a certain point of a good research, a good paper, and that will be published in a good journal. So I will add to that. Don't gather your data, make everything ready before you call on someone that is good in methodology questions. So from the moment you have the idea that you want to do something, you want to run a study about something, you need to add to your group, or you need to call on the person that will work with you. Don't gather the data and send to someone like, okay, this data analyze it for us. We are running this kind of study. So please be so kind and have the habit to appoint someone that is good in methodology. You will tell him your concern. You will let him know what you want, what you are looking for, what you want to demonstrate, what you want to come up with. And with him, we will start with the studying question, the research question, because many times the colleagues are going ahead with whatever they are doing and gathering data anyhow, and at the end, we will take back everything from the beginning. So the good practice, or the way it should be done, is to appoint and to call on the person that you feel that he is good at methodology or statistics, and he can help. Though he will help you with the formulating the question, we will assist you with this kind of question. This is the methods that goes with it, and these are the type of analysis that can be able to answer that question. So if I may summarize what Dr. Essene has said in that simple sentence. This is the question that you are asking. You are looking for this kind of thing. So this question needs this method, and this method will call on this kind of analysis. So please make sure you understand it this way. If I'm wrong in this summary, please, Dr. Essene, you are here with us. You are here with us. You can correct me. Thank you so much. It's always a pleasure, a great pleasure. We always learn listening to you. I can sit here listening to you till tomorrow morning. I won't be tired. Thank you so much. Thanks a lot. Thank you for being there for us. I said Dr. Nathalie raised her hand. Dr. Nathalie, please go ahead.
Yes, I just have a little question and a little query.
Okay.
Some sort of question that I have about Africa. Actually, we've seen other continental associations having their journals. What are the setbacks? What do you think are the setbacks that Africa, particularly sub-Saharan, maybe Africa, let's say Africa, is facing creating a continental journal?
Thank you so much, Dr. Natalie. I mean, yeah, this is has been a very preoccupying question. You know, putting up a journal requires a lot of effort. It requires a lot of dedication. It requires a lot of collaboration. CAANS is relatively young compared to other continental associations. So I think the question of the journal is in the pipeline. Hopefully, by the end of next year, there's going to be a journal for the continent. It's true, it's not going to be easy. I mean, when we developed the Journal of Global Neurosurgery, I mean, we encountered a lot of obstacles. Sometimes when you want to put up something comes up new, you encounter a lot of challenges. Sometimes there are a lot of forces at the global stage to ensure that these things happen. So, but rest assured, it is at this particular point in time, there is a burning need for a journal for Africans because we cannot keep on begging the rest of the world to publish our research work. We need to have our own space where we can put our own work. I mean, last week I was in Cairo, and I spoke with the authorities there. I was with the editor-in-chief of the Egyptian Journal of Neurosurgery, and you wouldn't believe they've already integrated a research capacity building course in all their annual conferences. So every year there's a special session for research capacity building, which is very good. And I was telling the president that this should be extended to other national societies. And in Africa, the Egyptian Journal of Neurosurgery is the only journal that is very functional. It is published by Springers. It's true that it's not yet indexed in PubMed. So I think at this point in time, there is really a burning need for a journal for the continent. And I think we have to put our forces together to make sure that this happens.
Okay, thank you so much. The last part of our gathering today is what you are seeing on the screen. I will present to you in 4 slides, just 4 slides. I present to you the 6th module that we have prepared to handle this this training of young neurosurgeon. So the first one that we are closing right now is the module 1, which we have been dealing with defining the research question and method. We are almost done with that. The next module will be the research project, gathering the generating the data, okay, which will come just before the data analysis, which data analysis will go with module 3 and 4. And module 5 will be about data presentation and writing. We will learn all about that. And module 6, we will see how we can progress our career in this field of research. So what we put in the module 1, you have seen it already. In module 2, module 2 will be the running of your project. So you have your research project. You have defined, you have framed your research question. You have the design your research, your study, and then you need to run the study right, the project. So the next webinar, which will be the module 2, will handle the question of running the project. We will talk about executing project, research project, the major software that can be used in research, and also if time allows us, we talk about how to fund and the project and getting a good writing for grant. The third one, which is the first data analysis, we will introduce you to Jamovi. Why Jamovi? Because this is the only one free software that is free of charge and can allow you to analyze your data very easily. So we will go ahead with the descriptive statistic, the main statistics test, analytic statistic, and the fourth one we handle the reviews, the systematic review, the normal review, the systematic review, comprehensive review, meta-synthesis, and the meta-analysis. And the fifth, which will be about the data presentation and writing, we will find a speaker that will entertain us with reporting results, show us, we will get together and see how to present to you the better way to present figures and tables, a good academic writing, a tip for tips for writing each study sessions. And when we leave that point, we will get to the last module. I believe that the time will allow us to do that, because this is the program, the curriculum, the short curriculum for 2025-2026, and we'll be running the webinar the research webinar each 2 months. 1 month will be for education, the other month will be for research, and the last one we will talk about the career progression. We will find someone that have a great experience in collaborative research in neurosurgery, how to choose the journal information, the mentorship, and how to become a good peer reviewer. So these are the 6 modules that we will be dealing with during this term of the UNCAMS research. So at the end of this 6th module, you will be asked to submit your research project for practice. And not even at the end, we will see how it goes. We might send you a link, because all these things that we are saying and all these courses, all these webinars are great. But if you don't practice, you will not get anything. If you don't take time and practice, you will not even remember that you have attended a webinar. This is sincere advice I'm giving to you. Please, I will see with the committee, with the EC committee, and you might send a link asking you to send your project. If you don't have a project, find one. And the first module that we just finished now, how to frame your research question, you will exercise it with it, ask questions in the group, in the UCAN group about that. I think you get many answers. And which kind of a method goes with that kind of question that you ask, you will find it also. This is the only one way you will learn. If not, all this webinar, we know you will not profit anything from it. The only one way you can get a profit from this webinar for UCAN research, please, you will be asked to submit your question, your research question, and this will be done under the supervision of the UCAN Research Committee. We are available to help anytime. We will handle it, and only those that are willing to practice, or will be willing to practice at the end when we finish the 6th module. They will see a great change in the way they see things and the way they handle research in all over our continent. So these are the things we wanted to share with you. Thank you so much. We look forward to guiding you on your journey in academic neurosurgery. Thank you for your attention. So we thank our 2 faculties that our entertainers have given us great speech, great presentation. Thank you so much. Thank you, Professor Mamushi. I think she has left for another meeting. Thank you, Dr. Esene, for this insightful lecture. I believe there's no other comment. So I will ask Dr. Kabulo if he's still with us, or if he's not there, the secretary of the UCAN secretary is there to say a word before we run up with this session. Thank you so much. Dr. Kabulo, are you still with us? Okay, thank you so much for being there, Dr. Kabulo.
For the wonderful webinar. Congratulations, Professor Mamuchi. Congratulations to our boss, Dr. Ignatius Esene. I want just to ask everyone to contact the research committee, to contact Dr. Esene. He is always available. He is the lover of research. So you can call him when you want for advice. Please submit your research question. We can work together. And this will help us, like I mentioned before, to promote research in Africa and to write our own history. So, like the webinars will be monthly, as Dr. Dokpono mentioned, 1 month for educational research, the other one the educational webinar, the other one research, and so on. So I ask everyone to join the webinar for the next time. It was a very good participation, and it was a interactive webinar. So the last thing I wanted to mention is about our country representatives. Please share the link when we are scheduling the meeting, so everyone can attend, because this is helping us to grow. So thank you so much for everyone for joining, and see you next month for the next educational webinar on vascular neurosurgery. Thank you, everyone.
Thank you so much. You can share. Thanks a lot. We thank the speakers. Okay. Thank you for participating. Bye-bye. See you in 2 months for another research webinar. Thank you.
Thank you.
Thank you. Bye.
Bye.